Solid as you can in your personal, emotional, and mental wellness. So, May is Mental Health Awareness Month. And so, even though we talk about mental health and family regularly on the show, across the country this month there's a major focus on mental health awareness. And why does that matter? And I don't know that we've talked, Juan, about why mental health matters and why we choose to talk about it on the show. And part of it is because any part of the body, including the brain, can get sick. And we know that millions of people every year are sick and faced with the realities of mental illness. We experience our ups and downs, but that's not what we're talking about, not the situation. We're really talking about more medical condition, brain-based conditions that occur that are specific to mental illness, that changes how we think about things. It changes how we feel. It changes our mood. And it can impact our lives in really, really bad ways. You or somebody you know or somebody you love is faced with mental illness. So today we're talking about African American men and mental health. According to the U.S. Office of Minority Health, 1 in 5 adult black males are more likely to report psychological difficulty than their adult white male counterparts. But conversations about the effects of mental health concerns are really somewhat taboo in the African American community. So joining us on the show today are 3 African American men and 1, of course, so that's 4. But you're here all the time.
Yes.
So you count, but you don't count today.
Right, I got you.
And so we're going to talk a lot today about why many black men seem to avoid discussions around mental health. And so I guess I want to just pose the first question to the 3 of you. Just from your own experiences, how do conversations go within your own peer groups when you're talking about mental health issues that come up? So either one of you can start, doesn't matter to me.
Well, I guess I'll start off. This is Reuben Lawrence. One of the major challenges, thing that first comes to mind when I look at the other gentlemen that are here with me, this is actually 3 different generations.
Yep.
Right. So
why do you think I invited you?
But I think that's a major significance because I'm 59, and that the baby boomers generation, for us, it's such a taboo to be. We feel stigmatized with having mental health illness. So for us, it's something that we see as being crazy, or it's something that we're dysfunctional, and not that it's just a process that we're going through, that mentally we are not working at our normal capacity. There's something that's distracting us, or something that doesn't allow us to fully focus and function. So it's something that a lot of us don't talk about, but we'll say, well, man, I'm really struggling today, I'm really feeling down, and not actually connected to depression or anxiety or some of the things that are actually part of that mental health challenge that causes us not to function fully.
Yeah, and and I guess as you say that, I wonder, when you were a kid, how did those discussions go? And I guess I'm wondering because I'm thinking about Jeremy and Tyson as children, whether those discussions, whether it was the same. So as children, what was it like for you as a kid when mental health stuff came up? Obviously, you, like you said, have somebody in the family that's just crazy family member, whatever.
Right. But it was something they didn't want you to be labeled. So it was something they stayed away from, something they didn't talk about. And if there was something in the school where you were labeled as being having any challenges whatsoever, then it was taken so harshly that the reality is, in a lot of cases, a lot of kids, I grew up north, they would be sent down south because it was a sign of disgrace that there was something wrong with your child.
Wow.
Yeah, this is Tyson Fant. One of the things that I think is really a huge catalyst is really the idea of a boy versus a man.
Right.
A lot of times we give birth to men. and we think that we have to raise little men from the beginning and not allow him to be a little boy.
Yeah.
And I think this false conception or misconception fosters like early maturity, right? So we can't be little boys. We can't cry. We can't be upset. We can't have pain. We can't have sorrow, because all that equates to weakness. And because it equates to weakness, we're afraid or we're intimidated to express any level of vulnerability with each other, because then we're labeled as weak.
Yeah.
We don't have the internal strength to deal with our issues.
Yeah.
Or we have to go pray it out. We can't seek out support or guidance. And then, you know, a big move, you talk about the baby boomers, right? When Reagan shut down all the mental institutions, right?
Yes.
That created a lot of confusion between who needed what level of treatment or support. And so you were automatically deemed as crazy if you needed any kind of support. And so you were less inclined to articulate it, express it, to share with anybody. And you kind of go internal, which creates, as we already know, more damage than good.
Right. And I think, I mean, growing up for me, it wasn't ever a conversation. You know, it wasn't talked about. It wasn't and it wasn't necessarily that it was taboo. It was just avoided. You know, and it could have been taboo. But it wasn't ever a question from my point of view, and then it also wasn't ever just a topic of discussion that was brought up. And so so when it was, okay, this family member, this friend, they've got something going on, it was viewed as, yeah, they are crazy, or yeah, they've got these issues going on, but it was never addressed from a medical standpoint, and B, from a caring standpoint. It was always this is a sign of weakness. And so now on the backside of this, I mean, I am still young, 27, but now on the backside of this, it's almost as if it's popular now to have these issues, and even in the younger generations, these young kids that are coming up through high school, they deem it as normal to be depressed. They deem it as normal to have anxiety, and they almost, I don't know if it's a self-deprecating thing, but it's almost like they make fun of themselves for it. Like it's a hey, everybody look at me, I've got anxiety, I've got depression. Whereas, which to me is a complete pendulum swing from the other direction, where it was, no, don't talk about it, don't look at me, I'm not different, I'm fine, everything's okay, to, no, I'm not okay all the time, and I've always got anxiety, I've always got issues, I've always got depression. And so it's just like, where are we? You know, where do we fit in that?
Yeah. Okay. So you're talking from your perspective as a youth pastor.
Right.
So Jeremy Skeete is a youth pastor. Tell us what church you're at.
New Season Church in Hiram.
Okay. All right. And so you see a lot of young people just in your work day to day, and you're talking about that's what you're seeing in young people. I wonder if there are differences. What's the demographic at your church?
Demographic at my church, it's Paulding County, Georgia, so it's pretty. I mean, it's country. You know, we're out there. We're out west. I tell people all the time, take 20 west out of Atlanta and keep going. And we're basically we're about 25 to 30 miles west of Atlanta, and so it's pretty rural. And so we do have. I mean, the majority of the people that, especially the young people that I see in my student ministry, they are white. And then I also see kind of a good mix of young black men as well. And so it's interesting to see this juxtaposition of what they view as okay and what they view as not okay. Yeah. And so it's been a ride. You know, I've been there for almost 2 years, and so getting to see where the young people are at in that area. And what they're dealing with, because they have different issues than the guys the kids that grew up in Marietta, or the kids that grew up in Fulton County. You know, it's even though we're only 25, 30 miles away, it's still a huge culture shift. It's a huge difference, and so it's definitely been interesting working through that. And like, I mean, just recently we had a young man. We were literally just talking. We didn't break it down to anything. It wasn't even a super deep conversation. But in the middle of the conversation, he just starts bawling. And I mean, just literally just breaks down. And so me and another leader pull him to the side, and we're like, hey, like, what's going on, you know? Obviously, you know, you've got some stuff going on. And he was like, he just basically confessed to us that he's got some anxiety and just depression. And he's like, I have no control over it. I have no idea what's going on. He's like, regardless of what I try, he said, I can't shake this feeling. He was like, and it comes and goes. It's like it's in waves, you know? And he literally looked at us. He was like, what's wrong with me? And it was just this idea that had already been planted into his head that something was wrong with him because he needed some help, or he needed he needed some support to help navigate those feelings, and then also at the same time possibly some medical help. And obviously I'm no professional or anything, but I can help get you there. I can help get you to a professional. I can recommend somebody.
Yeah.
That's exactly what we did in that situation.
Yeah.
And I mean, thankfully he's doing much better now. This is probably about 2 months ago, and he's been going to therapy. He's been going. There's a guy that we work with over there in Paulding County, and he's been going. He's just, I mean, improved greatly, and I do think he was. I do think that he prescribed something for him and got him going, but it was just this battle. You could tell this internal battle with him, and it was great to see that kind of just. I'm glad that it happened that way, that we were able to help.
You know, that very thing I think contributes to the stigma that Reuben was talking about before. Just the idea of, well, I have to be prescribed something.
Right.
Right. That whole conversation is, unfortunately, unfortunately, and the reality is, it is an illness like any other illness, like diabetes, like high blood pressure, like anything else that you need some balancing in your system right? But it's never really talked about in that light. And just the ability for a young man to find a safe space where they will be able to say something like that and to break down and to show that emotion, that's not always very common, right? As you were talking about before, men are programmed to just kind of shut that down. Suck it down, suck it up, deal with it. Shut that down, right? And so that whole idea of building emotional intelligence, building connection with and understanding of what's happening inside you from an early age and being able to talk that through so that you're aware of your emotions, you're aware of the different things, so they don't kind of compound. And then we get to teen years and boom, we've got this big thing. Right now we're just talking normal. We're not even talking when there's trauma. We're not even talking when we're just talking about regular, that's just a basic layer. All right, well, we got to take a break. Joe's back there telling me, take a break. So when we come back, we'll talk a little more. And I guess, Tyson, I'd like you to go ahead and introduce yourself when we come back and tell us about the work that you do, and then we'll keep going on. Stay with us, everybody.
Do you want peace in your family relationships instead of conflict? Do you want a safe, loving marriage instead of one that is failing? Are you troubled about what's happening with your children and need help for them? At Legacy Changers Counseling Centers, the goal is to strengthen individuals and families with cutting-edge emotional and mental health interventions. The exceptionally trained counselors at Legacy provide the specialized guidance you need in a safe environment of belonging so that you can make the life changes you and your loved ones need. Get real help for your emotional and relationship needs. Call today at 404-334-7575. That's 404-334-7575. You can also find us on the web at legacychangerscounseling.com. Call now and transform your life today. 404-334-7575 or legacychangerscounseling.com.
Welcome back, everyone, to the Dr. Sonja Sutherland Show. We are talking today about African American men and mental health. And as we left in the last segment, we were just talking about men's general socialization to just kind of shut those emotions down and not really deal with it, and how it can really just pop up in teen years, even really before that, well before that, in depression, anxiety, and many other things. So Tyson Fant is with us. Tell us a little bit about what you do, Tyson, and just why you think this is so important for us to talk about.
Yes, thank you. Well, thank you for having me on this morning. My name is Tyson Fant, and I am the Director of Admission at Richmont Graduate University. But I've also been in higher ed for like the last 10 years or so. I'm just relocated from Los Angeles, California. And the reason I think that mental health is so important is because I kind of found myself in that space by working in admissions, by learning about programs, academic programs, the outcome for students, things of that nature, and sort of like sparked more curiosity than anything else about what it really meant. And having worked at many different schools, having different programs, and one school in particular had an African American specialization in the program, teaching mental health. And it really tackled the idea of stigma and how to overcome the stigma with patients that were from different cultures, and really kind of breaking down those walls. Especially with minority groups, we find that pattern that we are forcing ourselves to be strong when we're feeling weak, and creating a mask of strength when we're feeling vulnerable and torn up inside. And so because of that, they created academic programs to sort of support clinicians who would graduate and meet different patients that were carrying on all this armor, all this damaged armor. And so that kind of sparked for me a passion for it. Meeting coworkers that were having anxiety on the job or stress or depression on the job, and like needing to quit and have time for themselves, and kind of being in that space where people are constantly leaving positions because of stress and pressure. And now I became an advocate for it, like thinking like, how can I support teams? And now as a director thinking, how can I support my staff? Make sure that they're in like the healthiest workspace possible. But then also noticing that there are none of us in the field right now. And I say that very loosely, of course, right? I'm working actively at Richmont to grow diversity in the Office of Admissions and to make sure that we are recruiting diverse populations to the school because we need support. And so I'm an avid on both sides, you know, seeing the curriculum, what it could do for a student, seeing the patients, seeing, you know, the necessity for a patient to go to a client and see their self reflected in that person, in the individual, and have a cultural foundation and understanding what they're dealing with, because we're all dealing with very similar things. And so that has really, it's inspired me to be here.
Yeah, you know, as you say that, Richmont has programs in counseling, mental health, clinical mental health counseling, marriage and family therapy, different things like that, ministry. And so very much the helping professions.
Right.
And as we talk about counseling and dealing with mental health in the African American community, you know, one of the barriers that does exist is there are not a lot of us out there.
Exactly.
In terms of the field of counseling.
Yes.
Minority counselors are not well represented within the field as professionals. And so there is a part of that stigma as well that's connected with, well, if I go, I'm not really going to be able to find somebody that looks like me and can understand my perspective. Right now, that's a generality, right? And so obviously we know that you can find a counselor who's not of your race and you can make a connection. However, when there's this big stigma around mental health to begin with, and when we think about the idea potentially, and this is part of what I think, some of what we deal with, where we see depression, anxiety, and other things in African American males, has to do with the results of racism and discrimination.
Exactly.
And so when you have that kind of underlying context, they are going to be looking for people that look like them. Right, in terms of intervention. So what do you think about that? Just the idea that racism, discrimination, all of those types of things that they face in the community, in the society, and dating back, just, you know, we're not talking about today. We are, but we're talking about historically, right? How do you think that plays in as well?
I think personally it plays a major role because it reduces trust.
Yes.
You know, we think back to the Tuskegee experiment, right? And how we went to medical physicians in faith and were treated poorly, right? We're given diseases and things that they be treated as guinea pigs. And that created a major catalyst across the nation for our culture to say we don't trust physicians. We don't trust any doctor. We don't trust any sort of paid physician because they're going to abuse us. They're going to misuse our information and use it against us. And so I believe it requires generations, plural, to break that facade. It requires more of us to commit to the field, commit to mental health, commit to mindfulness, to be able to break that barrier down for us to increase trust. Then we're going to go. I think we see too many barriers. All we see is barriers, and that makes us stay at home.
Unless someone say, oh, that was a long time ago. It really wasn't that long. That long.
It
It
really
wasn't that long ago.
A lot of it, even in my lifetime, I've experienced, you know, particularly moving from New York to the South. So when you talk about, you know, for particularly an African American young man, when you think about all of your life being, you know, whether called boy or being considered as less than and not as equal, and the name sometimes, boy, you stupid, or boy, that boy's so crazy, and then you want me to come and tell you that I'm struggling with something when you already think that I'm less than. You know, as Tyson said, there's a distrust there. There's a distance there that you can't identify with where I am or what I'm going through because you're part of the problem. And it may not saying directly, but indirectly, you know, you have been telling me, giving me a label, giving me a sense of less worth. So now, in order for me to find worth, I need to be able to see someone that I can identify with. As we often say, someone who feels my pain.
Yeah. And it's always been a question of mine, and I don't have an answer for this, just why African Americans just in general, minorities in general, just don't get into this field. It's you know, is that exposure? Is that part of the stigma? Is that what is that? Is that just what we understand to be therapy being based in Western culture norms, and so really we're not really just there yet? You know, what is that?
Yeah. Well, I think part of it is you got to feel invited to the party.
Yeah.
Right.
Yeah.
You know, and if you don't feel like, man, you've got something to bring to the table, I want you to come, then like Reuben said, if you already have this mindset of, man, they already think less of me, even though that may not be a generality across the board, it may be a few specific people here and there, it creates this mindset again that, man, I can't join the party, I can't be a part of that, I can't do this, that, and the third. And like, again, I think it is, we create barriers for ourselves. They might not necessarily be there, but we create them in our minds. And so we say, no, I can't aspire to do this. I can't really, I want to help people, but maybe I can only be a social worker. Maybe I can only go this far and do this much. And even though they might have the aspirations, the dreams to go further and do better, I feel like, man, I'm not invited to that party, so I'm not even going to try. I'm not even going to try to bring myself there.
So much comes to me when you say that. You know what I mean? Because that whole idea of not being invited to the party, it makes me think of, and I know we're talking about counseling, but when we talk about the educational system, to me that's part of not being invited to the party.
Yeah, right. Yeah,
right? And so even that idea of thinking that you can reach for something, right, starts back in your school and the education that you get. I know as a teacher that when I have over the years looked side by side at certain groups of people, I see the educational disparities. I see why certain students aren't really getting to college. Because when they get there, I can see the difference. And I wonder, whoa, what went wrong in their elementary and high school? Why they don't know this, or why they don't understand this, or why they can't do this, right? And I see it very clearly, right? And so that whole idea of, am I being invited to the table? Now we're talking about really institutional discrimination that separates people from the table. And so, yeah, you're right. That is part of the answer as well, why there are not as many. Because on an educational level, you've got to have the master's degree to be licensed as a counselor. It's not an undergraduate degree. It's a master's degree. That's a whole, at the minimum. And that's a whole different level once you get to graduate school. And then if you say you're going to do a PhD or a PsyD or something like that, you know, that's, and if educationally they are not really prepared, and we know that differences in educational systems and money and all of that stuff is rooted in our institutional fabric. It's not just, you know, it's housing values and money that goes to schools or doesn't go to schools, you know, that kind of thing. So,
well, let me give you an example of something. Young black man comes up to a teacher. Young black man teachers, wanting to tell, this is, I'm so and so, and this is what I do, and my interest is counseling, and I want to do this and that, and I want to help people, and I'm on the basketball team. Immediately, where does the focus of the teacher go to? It goes to basketball. The value of our development, if it's not stacked in certain areas, athletics is number one, then entertainment is number two, then if you say business law, all of these things that in the limelight of a career of making money, we're pushed towards that area, and we're given the impression that this is what it means to succeed when you become, if you say doctor, it's a medical doctor. But never do you hear them saying, oh yeah, man, we really need some black men in counseling and therapy, the things that trauma therapy, the things that the norm of what we work with and what we deal with, that is not an emphasis. But our value particularly is more focused on entertainment and sports. That's sort of the undercurrent, well, it's not even undercurrent, overcurrent message that's given by society is that's where you're the most valuable.
Yeah.
Yeah.
But it goes back to the idea of the child.
Right.
You know, if that black child walks up to a teacher, is he seen as a man or as a child?
Right.
And how is he approached?
Right.
Because if he's seen as a child, he's going to be not pacified but supported.
Right.
That's my theory, right?
Right,
If he's
okay.
seen as a child, he's going to be supported
Right.
and walked through the process and groomed and molded and kind of like thoughtfully conversed with. If he's seen as a man, he already has the answers, even though he's 6 years old.
Right.
Then he's going to be approached as so and
Right.
given less support, less guidance. Oh, just go and do that.
Right.
Or you're already good at this. Go ahead and do that, and
Right.
not consider what he really is going to be good at.
Right.
Right.
You know, and that's why it's so important for us to think back to what does the household look like as well.
Yes.
Where is the attention going?
Yes.
Are those parents so focused on just trying to have a job, trying to make money for that
Right.
household, where they're giving less attention to that child and depending upon the school to give all the attention to that child? And therefore, that child is just kind of getting left behind,
Yeah.
and later on is struggling
Yeah.
and still wants to have a successful career, but can only do one thing, which may be a physical sport.
Yeah.
Or is that child getting the support that they need every step of the way?
Right.
Yeah.
Right.
So
Yeah.
that's why I think it's so important to think about play and play
Yes.
theory and those
Yes.
kind of ideas.
Exactly.
You know.
I think honestly we also perpetuate it as a culture too.
Definitely.
Yeah.
And it's probably not going to be a popular opinion, but I hate the term educated black man. I absolutely hate it. Because to me there's a distinction there.
Right.
Right?
Right.
Why can't you be a young black man?
Right.
Right? Why does it have to be educated? That's an assumption that young black men are not educated.
Right,
Or young
right.
black men can't be educated.
Right.
And so to me, I literally, that phrase gets under my skin because it's like, no, you're a young black man, period. Like you don't have to be an educated young black man. That there shouldn't be that distinction there because we should make the assumption that young black men can't be educated. And that's not something that they're doing to us. That's something that we're doing to us. Right?
Yeah.
And it's just that mindset of, man,
True.
I'm going to continue. I'm going to be blue collar. I'm going to do this. I'm going to work in the factory. And this is what my dad did. This is what
Right.
I'm going to do.
Right.
So I'm going to stay here and do that. Even though when I was 6 years old, I told my mom I wanted to be a doctor.
Right.
Right?
Exactly.
Even though when I was 9 years old, I told my mom I wanted to go to the moon. Right? We have these dreams and aspirations. And then, man, we start getting killed again because I think that mindset is this is a man, this is not a child,
Right.
A child you would nurture, a child you would help grow and support. But a man, it's no, be realistic, right? No, be realistic. You live in this area, you're from this part of town, you're going to do this with your life, period. Rather than let me help nurture those dreams and aspirations that you have inside of you. And honestly, I think in my line of work, I'm in the middle of that, right? Because especially with young black men, they're at that age where if you're 15 and you got darker skin, you're a man, period.
Yeah.
Our society tells you that, our culture, even our culture tells you that you're a man. And so you've got to have the answers. You've got to have it figured out. And so I'm seeing these young men who are still trying to figure out their lives, still trying to figure out what they want to do, but they're being told that, no, you're a man. You've got to have it figured out. You've got to know where you're going. And it's just like they have no direction. And
Here's
again,
that anxiety you're talking about.
exactly.
Yeah.
Oh, my goodness, yes. And to me, it's crazy that we're seeing in 15 and 16-year-olds this rampant anxiety and rampant depression. And I honestly think it's a symptom of, man, this culture that we're perpetuating that you have to have it all together, even though you're 15 and 16. I mean, I'm 27 and I'm still working on getting it together.
Well, I got you beat. I'm 51.
Right.
Yeah. You know what I find that's a little disheartening is there's also that disconnect when it comes to physical health with mental health. A lot of the issues with physical health can be related to our mental health because that mental health, once it starts to decline, it affects the body and the mind
Right.
Yes.
Right.
tremendously.
Yes.
Right. It's just-
And the sad thing is that because of our culturally, the way that we're brought up, we don't relate the two.
Right.
And with them being separate, we can never become fully whole.
Right.
You know, so that's the sad thing about the disconnect between the mental health and the physical health,
Yeah.
and how one definitely affects the other.
Absolutely.
You know,
in both ways.
direct- yes,
In both directions. That's
ways.
right.
Yes.
Exactly.
Yes.
That's right.
Right.
That's right.
Right.
And when we talk about poverty and add that layer to it, when you're dealing with African American men, who have been poor and continue to be poor, that has an impact,
Yes.
a huge impact on
Absolutely.
mental health as
Yes.
well, and
Absolutely.
physical health
Yes.
as well.
Absolutely.
Yeah.
Right.
And,
Yeah.
and I think one of the generational things that have impacted us, young black men, the greatest, is that it's a perpetual thing that because a man doesn't have, whether it's the opportunity, is not able to develop himself, he does not know how to stay in the home. He does not know how to foster his children and guide his children. So he leaves the home to try to find
Hang
identity.
on right there, 'cause that is a whole conversation.
Oh, no, yeah, okay.
So we're gonna take a break, and we're gonna
Okay.
pick up right there when we come back. Be back in a minute, everybody. All right, welcome back, everybody. And so, Reuben, you were bringing up something really significant when we left. But before we go back into that, just tell us a little about yourself, what you do in the field.
I'm Reuben Lawrence. I have sort of a dual role. I'm a marriage and family therapist. My wife and I have, who's also a marriage and family therapist, have a practice in Marietta. And we've been working with couples just in various capacity over the past 20 years, just helping to build healthy relationships and healthy marriages.
What's the name of your practice?
It's Lawrence and Lawrence Consultants, right off Powers Ferry Road. But I'm also a director of a substance abuse clinic, substance recovery clinic, and I work with people that are recovering from substance abuse using the method MAT, medically assisted treatment, using methadone, and used in the proper way. It can really help people that are really struggling, and that's why I see a lot of young men that really are caught in the addiction of heroin and fentanyl and the opiates, find a way of using this to get a balance in life, build a support system, and then eventually come off everything. So regaining their life back. So that's been an honor in really working with men in that capacity.
It's amazing.
That's awesome.
But the focus what I talked about is one of the major challenges or deficits that have been here are men who go through the struggle of not being able to balance their own lives. And in the capacity of trying to search for their significance, who they are, deal with the various challenges that they're having, a lot of it is mental health challenges, they leave their home or they don't stay in contact with the children that they bring into this world. So now you have him struggling on his own about not finding himself, as well as not being who he was meant to be in the home and for his children, and then his children that grow up without.
That's right.
So we have a lot of young African American young men that are growing up, like you talk about, Tyson. They don't get a chance to be children and boys because there's no male to image and to help mold them. So at 5 years old, everybody say, "Oh, that's my little man," and no, he's a child. He's a baby.
Exactly.
So they're automatically pushed ahead and not able to experience that developmental process of understanding, knowing who I am, and just really working through how do I balance growing up, whether in elementary school, just in general. And typically, that's when they're pushed to sports.
Yeah.
So, or different things that doesn't allow them, it's almost like capsizing their emotions, and then it's pushed into aggression.
And so you are talking about how generational
Exactly,
mental health
generation,
issues-
exactly, because it continues, because then when that young man starts to struggle, instead of
Yeah.
having a father that can say, hey, listen, this is what I struggled with too, and give guidance or bring him support, he's left to try to fend for
Figure it out.
himself. Exactly.
Which is why when you said at the beginning of the show that it will take generations to really impact this,
Yes.
it's because we're looking at generational
Yes,
mental health issues that
Yes.
just
exactly.
have been untreated,
Exactly.
unrecognized, and we see the impact in our young men who are aggressive.
Yes.
Our young men who are struggling,
Mhm.
right?
Mhm.
And the blame is laid right at their feet.
Yes.
Right at their feet, without any look at the context, at the
Exactly.
history,
Exactly.
at how this came to be.
Exactly.
It's not something that has just, it just is.
Exactly.
It's something that has evolved, and there are
Exactly.
reasons for it. And even as we talk about something like that,
Mhm.
what it means is that input is needed from so many realms
Yes.
It is.
Yeah.
to mediate
Yes.
what is now present
Yes.
in our African American men,
Yes.
right? And many times it's left to moms,
Yes.
Yeah.
Exactly.
right,
Yeah.
to figure it out,
Exactly.
Right.
Exactly.
right? Who was talking about it? Who is working 60 hours a week
Yes,
to
exactly.
make
Trying to balance
enough
everything. Yes.
Right.
to figure out
Exactly.
how am I going to support,
Exactly.
right? And so meanwhile, this child is left to fend for
Right.
himself.
Exactly.
It's a vicious cycle.
Exactly.
It's a vicious cycle.
Exactly.
And mom, who needs that support,
Right.
doesn't have that support.
Exactly.
Right?
Exactly.
And oh my gosh, we could talk about so many things.
No, you make a great point because earlier you mentioned emotional intelligence.
Yeah.
And just kind of understanding, first of all, who you are and how you deal with your own emotions and those of others. But something we also have to consider is gender intelligence. You know, something I kind of stumbled upon in my master's degree program was gender intelligence and how when, for example, a woman is raising a child by herself without that extra support, she has to navigate from her perspective,
Right.
this little boy, right? But he has ways of thinking that are going to be different and unique to him because of his gender.
Right.
And if we don't approach that aspect of the conversation, there are things that men do, for example, we need to go away from a conversation,
Right.
kind of rethink about it, and then come back to that conversation to be
Right.
able to address
Right.
it as
Right.
healthy as possible.
Exactly.
But we say in that moment, then we may be a little irrational in that conversation. So we
Right.
need a second to kind of back away from it and then come back. And the book is called Going to the Balcony and kind of hanging out for a second, retooling, and then coming back.
Right.
Another thing is that we kind of compartmentalize things a little bit differently. We have like
Yes.
these drawers
Yes.
we put things into, right?
Okay, wait, I'm going to sit back and listen. Tell me about y'all's drawers.
So whereas a woman can be perceived as having like a network of
Yes.
thinking,
Yes.
we have drawers or
Right.
compartments of thinking, and so we do have a drawer that's actually empty on
Right.
purpose.
That empty,
And you go to that empty drawer and you kind of hang out for a second.
That's right. That's
So you
right.
may ask your spouse, "What are you thinking about?" "I'm not thinking about anything."
Exactly.
And you're literally thinking about nothing.
So all four of you are saying yes.
Absolutely.
But the more we understand that idea,
Yes.
the easier it is to have conversations,
Right, right.
especially heavy conversations,
Right.
right? Because we realize we need to go to the balcony,
Right.
we need to go into the empty drawer for a
Right,
second,
right.
or we're compartmentalizing these ideas. They're not all connected to each other.
Right.
And the more we kind of expose and explore these ideas, I think the healthier
Yes.
as a community and as a family we can really be.
Yeah.
So let's do this. I'm your mother,
Okay.
and I'm needing to have a heavy conversation with you.
Mm-hmm.
So let's role play this, because I want to hear how this sounds
Sure.
like in conversation,
Sure.
right? So Tyson, okay, how old do you want to be, Tyson?
You know what? Let's be 8. Let's be 9.
Okay.
Let's be 9 years old.
Okay.
How about that?
All right. So let's say something happened at school,
Mm-hmm.
and you're upset, I'm upset.
Right.
Tyson, what happened in school today? Your teacher called me. She told me you got into it with another young guy. What is going on? You know I expect more from you. Talk to me about what's happening for you, because you're going to be grounded. But let's talk about it first. What happened here?
I don't know.
What do you mean you don't know?
He messed with me.
And
He kept calling me names.
yeah,
I
but
don't know what happened.
Tyson, we've talked about this. You know that when people confront you in that way, I've told you, back away, take a time out.
All right.
What's the deal?
I just couldn't think straight. He kept pushing me. Nobody understood. He didn't understand and leave me alone. And I had to react. I had to get him off of me.
Tyson,
I
you didn't think.
just need a minute. I can't think straight right now.
Okay. You know,
Now, what would your norm be?
Mm-hmm.
What would
What
your
would my
norm be?
norm be?
Right, when he says, "I just need a minute to think."
Well, I'm
That's
a
a
counselor.
more mature response.
But,
too.
but I'm saying,
I'm a
but
counselor.
I'm saying, as
I'm a
parent,
counselor.
But as a parent,
Right.
what is your norm when
Yeah.
he says, "I need a moment to think"?
No.
Exactly.
You're not getting out of the hot seat. You're gonna keep telling me what your problem is, so I can figure out what we need to do from here.
Exactly.
Well, Mom, that's not how it works. I
Right.
need to stop and think about
Right.
exactly what happened.
Now, the 9-year-old wouldn't say that.
Exactly.
Right.
The 9-year-old.
That was a mature piece of it. That was a mature piece of it. Right.
Yes,
right,
the
right.
9-year-old, depending on what
Right.
could slam out the room,
Exactly.
could shut down,
But if you had said
throw a
to-
tantrum.
But the difference is, as a 9-year-old, if you said, "Okay, I see you're getting upset. Here's what I want you to do. Go to your room and think about it,
Right.
and we'll talk about it after dinner."
Right.
So it gives
Right.
him time. It
Right.
feeds him, allows him to calm down, where he can process. Well, Mom, I know I shouldn't have, and then explain himself.
Yep,
It doesn't
exactly.
justify it, but allows him to go to that nothing box to gather. Why did I really do that? And then come back and answer your question.
And not to mention, taking that time away, he's going to know what you're thinking.
Right.
You're his mom.
Right.
He's going to understand, Mom, you should have had me do, I would have done X, Y, and Z if I was
Right.
in a different mindset.
Right.
But what's happening is he's a tiger in a corner.
Right.
Yep.
And he's reliving that moment that happened to him earlier in that day that got him in
Right.
trouble in the first place
Right.
with his own mom. And so it's creating that gap.
Yeah.
And it's sort of enforcing that gap because now you're turning it to what happened to him in the first place.
Yes, yes.
Right.
And those types of conversations, look how you're saying it needs to start early.
Yes.
Oh, yeah.
That's
Very,
right.
Yes.
very early.
Yes.
Very
So
early.
we're talking 4,
Yes.
Yeah.
5,
Yes.
Yep.
3,
Yes.
Yeah.
right?
Yes.
And those types of patterns, it still speaks to mom or dad and their own emotional intelligence, their own history and ability
Yes.
of being able to deal with their own emotions.
Yes.
How were they taught
Right.
to deal with their emotions?
Yes.
Were they taught to deal with their emotions?
Right.
Are they simply patterning what they
Exactly.
They saw
learned?
Exactly.
or didn't see.
Or
Yes.
didn't see?
Yes. Yes.
Exactly,
Yes.
right? And so it becomes so important. So now really we're talking about, in some respects, how do we raise young African-American boys,
Yeah.
right? What are the things that we need to think about and understand just about boys in general,
Right.
right? Aside from all the other things that kind of fall into play when we add African-American.
Yeah.
Yeah.
Well, I think you touched on it heavily, and I was blessed as a young child to have parents that were under teaching that understood that the difference, the large difference between the way men and women think.
Right.
And there was a book I remember my parents reading and a bunch of people at the church that I grew up at reading called "Men Are Like Waffles and Women Are Like Spaghetti."
Okay.
And it's that idea that women are like spaghetti. It's all networked together. It all flows together, right? I'm feeling this situation, and these are my feelings toward it. Everything flows together. Whereas
Right.
for men, we have boxes like waffles, right?
Exactly.
And it doesn't spill out, right? I can
Right.
put it in this box. I can go sit that box over there, and I don't need to deal with it. And it's that idea, and I think God did it on purpose.
Yes.
To be
Oh,
honest,
yes.
Yes.
because I believe men are created to be warriors, right?
Right.
And in order to be a warrior, you have to be able to detach yourself from certain things
Right.
and be
Yes.
able to say, no, I can be in this moment, I can be
Right.
dad in this moment, but I can go and be warrior in that moment if
Right.
I need to be. But I think it gets us into trouble
It does.
as well,
Yes.
right? And so it's either A, we stay in that box too long, right? Or B, we don't allow ourselves to find that nothing box or to go to that nothing box to really back out of the situation and say, okay, man, this is what really happened. This is why I was feeling that way, and to process through that, because I think we've had this mentality. And look, to me, it's almost all interconnected because, man, I don't have the time to because
Exactly.
I'm working 2 jobs,
Right. Yep.
right?
Right. That's
And I don't have, man, I've got kids, I've got a wife that needs my attention, I've got 2 jobs. I don't have the time to sit
Right.
there
Right.
and think for myself and take a moment for myself because I've got X, Y, and Z that I have to do, that I have to take care of.
Along the lines of what you said, one of the things that my wife and I often do is we'll do family sessions. There'll be an issue with the family, and we'll have, the husband and wives, typically it's husband and wives, come in, we'll talk to them, and then we'll have the kids come.
Right,
Okay,
okay.
when the kids come, we don't want the parents there.
Right.
Typically, we ask them not even to be in the building because we want the kids to be able to verbalize where they are, what's going on from their own perspective.
Yeah.
And it's amazing how, particularly when you're talking about young men, whether there's it's mom and dad or just mom, when they start describing the situation, and then we start talking, so I start talking to them, so, what were you feeling? What are things like on the norm in the process of your communications with your mother and father? It's amazing how they can tell you exactly why they detach or why, they're doing certain behaviors, and it's because they don't feel that they can actually process things with their parents. There's that disconnect, and part of it is, like you said, Jeremy, teaching them a concept of being able to go to the nothing box, finding a place where they can go and think about, process what happened, and not allow their mind to get caught up with them. A lot of them like to use music, so then we'll refer them to, okay, so we don't want you to put on Biggie Smalls or something that's heavy,
Right.
but put on something that's light, soft, maybe some soft piano, violin, and just lay down and think about. Don't necessarily think about that, but allow yourself to just process. And that them understanding that, going to that place, they begin to develop coping skills of how to manage themselves and how to reflect on their behaviors in the time that they're starting to change.
Well, that's great. So it then kind of pushes us towards how not dealing with emotion early on pushes mental health issues, and then as adults, how that translates into how am I with my family, right?
Exactly.
Right? And so that becomes the bigger issue.
Right.
If I am an African American male with a family, dealing with mental health issues myself, how does this impact the family? All right, what does this look like with me and my wife? What does this look like with me and my kids? What does this look like with me on my job as well? Right? And what gets in the way of my recognizing that, okay, something's really off here, and it is mental health
Yes.
related,
Yes.
right?
Yes.
What about all those questions?
It's often hard for them. Some of it is lack of understanding. For instance, we get people that come in all the time. Well, my mother had anxiety, my grandmother had anxiety, I have anxiety or depression. They don't understand what's really going on. So to really help them navigate through the system is first giving them an understanding. We talk to, in a lot of cases, particularly men that get enraged and have anger problems and challenges. And when we start to really process through, they don't identify the fact that they may be depressed because work situations or job situations, or they may have, anxiety because things are happening, with work and bills, or just feeling inadequate. Particularly, I talk to a lot of men now who are my age going through, well, I'm past, I hope, midlife crisis, but in that stage of life where you're reflecting on what you've already done, you're reflecting on what you have, and you're saying, man, I missed it, or how do I catch up? And that's when, particularly for men, we start making decisions that are irrational because we don't know when we're not able to process it. So when we're talking about that depressed time and going through this, when you're viewing these things, they don't understand that this is something, in some cases, there may be a chemical imbalance that need medication. Or in other cases, there may be coping skills that needs to be taught. But directing them to counseling to help them build the ability to manage themselves when these instances occur. And I think that's one of the issues with mental health. They see it as a lack of themselves and who they are, rather than possibly being a chemical imbalance, or in a lot of cases not having the right equipment, the coping skills, or somebody to walk with you through this process or through this situation so that you can understand it from another perspective than tragic as what you're seeing it.
And as you talk about that, the thing that comes to me as well is very often there are childhood, family of origin things that have occurred
Oh, major.
that
Yes.
are unresolved.
Yes.
That
Yes.
are at the root
Yes.
of some of that,
Yes.
that pull their way all the way through to
Exactly.
adulthood, 40, 50, 60,
Exactly.
right, unaddressed.
Exactly.
Right, and what do I do with that?
Exactly.
Kind of stuff.
Exactly.
Right, and it shows up in depression. It
Exact-
shows
yes.
up in anger. It
Yes.
shows up in anxiety. It shows up in a lot of different ways
Right.
that folks don't really make a connection to,
Exactly.
right? And those conversations don't happen a
Right.
whole lot either,
Right.
right? A point that you make very well, Jeremy, is that it's essential for there to be a healthy family. There's got to be a healthy male leader.
Yes.
Not to say that healthy female leaders,
Right.
that's not the conversation.
Right.
We're just talking about
Right.
male
Man,
leaders in the
exactly.
family,
Right.
right? And for your family to be healthy, you have to be healthy as well.
Yes.
Right.
And you have to have the conversations about mental health
Yes.
and mental wellness.
Yes.
Yeah.
And, and we can recoin that, right? As counselors, we talk about wellness, right? Mental wellness,
Yes.
emotional wellness.
Yes.
How do I become proactive in fostering my own wellness?
Yes.
Right.
Yes.
Right.
My own psychological, mental wellness. And that just needs to be part of a conversation to
Exactly.
have.
Yeah.
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 Exactly.
Yeah.
Yeah. So, in the absence of the conversations, where do we start? How do we start them?
I think honestly we're at a tipping point right now.
Okay?
I believe in culture, in society where we are right now, especially the younger generation, my generation, we are at a place where it's okay to talk about this. It's not taboo anymore, which is great. I think that's amazing. I think that's awesome that we're there. But what I also don't want is what I'm already seeing with young people is that pendulum swing from not only is it okay to talk about it, but I'm going to talk about it so much that it's a focus for me. And not only is it a focus, it becomes almost a joke.
Yeah.
So now I'm going to interject there.
Right.
Who's it okay to talk about with? Who are they talking about it with?
Right.
They're
Right.
talking about it with each other.
Uh-huh.
They're not talking about it with their parents.
Right.
They're not talking about it with counselors.
Right.
They're not talking about it with adults who are having conversation
Right.
Right.
about
Right.
mental health.
Yeah.
They're talking about it with their peers.
Right.
Yeah.
Right.
Hence what you see.
Right.
Yeah.
Right.
Yeah.
And the problem with that is there's no accountability there.
Right.
Yes.
Exactly.
Right.
Exactly.
Yeah.
As an adult, man to man, if Tyson and I have a conversation, I say, man, Tyson, I'm struggling with this, that, and the third. As a man, he has the wisdom to tell me, man, go see somebody.
Right.
You need go talk to somebody. Go work through that with somebody. Man, it'd be a good idea if you go see somebody.
Right.
But as a teenager, they don't always think that way.
Right.
Man, it's gonna be okay. Everything's gonna be all right. They don't think to themselves, man, there may be underlying issues here that I can't just be a friend about. You need somebody with some wisdom, with some training, with some education that can take you through this, help walk you through this. And maybe there's some there's some physical things going on with your brain that we can't just talk through. That you need somebody to assess, to look at. And so because of that, I think it can cause this vicious cycle of I've always had this issue.
Yes.
I've always dealt with anxiety. I've always dealt with depression, and so I'm not going to go see somebody
Right,
because
right,
nothing's
right.
new.
Right. Right.
And so it's this idea of, man, since I was 17, since I was 16, I've been dealing with these
Right.
issues. I don't need to go see somebody.
Right.
And then, to be honest, as a black culture, we suck as far as going to see the doctor.
For medical things.
I'm just talking about your body. I'm not even talking about your brain. We don't go see the doctor. You know what I mean?
Yes.
Drink some water. Like, that's the thing, right?
Exactly.
Oh, your head hurts. Drink some water. My stomach hurts. Drink some water. Like that's what it is. My head. It's
Exactly.
either drink some water and go lay down. That's what it is. And so it's this idea of you can self-help, you know,
Right,
like you
right.
can self-medicate or you can work
Right.
yourself through these things, and that's not always the case. Like
Exactly.
it is really okay to go see somebody. Even this young man that we have this situation with, he told us, he said, I don't want to go see somebody. He said, I don't want people to think I'm crazy.
Right. Right. Exactly.
And we told him, look, it's okay to not be okay.
Right.
Like, and it's okay to talk to somebody about
Right.
that. But don't stay where you're at. Don't
Right.
stay just there in that moment, in just wallowing in those feelings
Right.
and in that possible dysfunction.
Right.
Because you haven't had somebody to help you work through those things. And so, I honestly, going back to what happens to the family, is we have these young men that have have an absent father, and that could be a physically absent father or a mentally absent
Yes,
father
exactly.
or emotionally absent
Right.
father. Because they're checked out, we now have these young men and young women growing up in this very possibly dysfunctional family, right? And then they grow up and then they leave the home because they never saw anybody deal with their own issues.
Exactly.
And so they're now leaving the home and they're creating another broken home.
Right.
And it's, again, that vicious cycle. And so where do we stop it, right?
Right.
And I think we're at that tipping point right now is where we can have those conversations, we can have these conversations, and then we can also say, to our young black men, right, that are going to become educated because they can do that, right?
Right.
They're going to become educated. We're going to tell them, no, look, we want you, we need you in this field because there are things in our culture that are specific to us
Yes.
that we need somebody to be able to talk through with. And so I think, honestly, we're in a good place right now because it is a little more normative to talk about mental health. Unfortunately, it came with a lot of blood.
Yes.
It came with a lot of pain.
Yes.
And it took us a lot to get there, but I think we're at a good spot right now
Yes.
where we can start these conversations, even in the home, right? As parents, as faith leaders, right?
Right.
We can start these conversations now, and then it's, I was 16 and my dad had a conversation with me about mental health and about, if I need to go see somebody, we can do that.
And one of the other things that's tied into there, because peers don't hold each other accountable.
Right.
The other thing comes, where they start, you're okay because I'm okay. Because if I tell you that you're not okay, then that means I'm not okay. So we both have to be okay.
Right.
And then they'll run across a friend that says, well, I'm okay, but what helps me is Xanax. So then they get into the drug scene because now they're medicating something, improperly medicating, and they say, oh, this helps me think now. But because it's not guided and doctored and guided by a doctor, and it's not given, it's prescribed individually because it's for you, because that's not happening, now I'm addicted to Xanax, opiates, and then I'm not getting the full effect of it, so I add fentanyl to it, and we have all of these deaths because they're typically fighting the issue of how do I handle this mental health challenge that I don't understand.
So, you're saying that we have more young people who are at least open and wanting to have the conversation with each other.
Right.
However, because they're having the conversations with each other,
Right.
the result is that it's really not that helpful,
Exactly.
and they self-medicate.
Yes.
A lot of them
Yes.
do. Not everybody,
Yes. Not
but a lot
everybody.
of them do.
Exactly.
Right?
Exactly.
And as you say that, what that says to me is that means that they don't feel like they can have those conversations at home.
Yes.
Right.
Right?
Correct.
Yes.
And so since they don't feel like they can have those conversations at home, they have them someplace else.
Yes.
Which goes back to, where are we in the adult world then? Because what I'm sensing is, in your generations, those conversations are starting to happen. And so parents who are 20-somethings, 30-somethings, maybe even early 40-somethings, are starting to be open to having those conversations. But parents who are 40 plus, 50, 60, are still kind of,
Yes. Yes.
and so those conversations are not happening,
Right.
right? How do we get that change? That's kind of where we need to go, right? Even within churches.
Yes.
I mean, the conversation that you're having with me about being a youth pastor and recognizing mental illness and referring out, that happens, but that doesn't always happen.
Right.
There's a huge thing still, block still, even in the church. We'll pray it through, right? We're not going to refer, come to the pastor for counseling,
Right.
Yeah.
right? Not the pastor who's a counselor.
Right.
The pastor.
That's who's a
Right.
pastor. Right.
Who's a pastor.
Right. Who's a
And
pastor.
didn't go to school for
And now, even as I say that, I want to make sure I express respect for pastors,
definitely, yes.
because the role of pastoral counseling is
Right.
so significant.
Exactly.
It is.
That spiritual realm,
Exactly.
that spiritual guidance and shepherding,
Yes.
that is the pastor's realm, and
Yes.
we need that holistically.
Yes.
For people to be whole and healthy holistically, we have to have pastors
Yes.
who are leading and guiding and providing that spiritual counsel.
Yes.
But when we come to other stuff,
Yes.
and pastors kind of go into that realm and
Right.
don't recognize when there are other things that are going on that they need to
Right.
refer for, that's because those mental health conversations
Yes.
in that church are not happening.
Yes.
Right.
Yes.
Nobody's talking with that pastor
Yes.
about mental health and what it is and what it means, and that becomes a huge barrier. And if the pastors aren't doing it and not talking to the parishioners about it, they're not going to have those conversations with their families. There's this huge ripple effect, and so the power
Yes.
of the church
Yes.
is, I think, a little bit, just not a little bit, a lot misunderstood and underutilized when it comes to mental health.
Right.
Yeah.
Absolutely. I think a lot of that even stems from this ancient idea that church and science have to be separate.
Right. Exactly.
And I
Totally
think
false.
Completely false.
Yes.
I believe that.
Yes.
I believe that faith and not religion per se, but I believe
Right.
that faith can support science and science can support faith. And I think even now, where we're at, I think that's starting to become a thing. I think that's starting to take hold in the faith community, which is great. But one thing that I will say about the lead pastor at our church is he didn't go to school for counseling, and he knows that, and he stays in his lane.
Right.
And so he's not one to go and have 6 and 7 counseling sessions with
Right.
somebody. He said, "No, I'll sit down with you and we'll
Right.
talk about it."
Right.
He said, "But if you need help, that's how I knew to refer that young man
Right.
to a licensed therapist,
Right.
because I'm not a licensed therapist.
Right,
You know,
right,
the
right.
lead pastor of my church is not a licensed therapist. I didn't
Right.
go to school for that. He didn't go to school for that.
Right.
And so I'm not going to assume that because I have maybe a little more Bible knowledge than some common people that I can understand all the things that are going on in the brain. No, because I don't think that science and faith are completely separate. And so I'm going to stay in my lane.
Right.
I'm not a licensed counselor. I would love to help you find one though. Kind of thing.
And that's what our pastor has gone towards, because it's been so evident. We have, like, with your church, we have a youth ministry that we've been growing, and we work with several of the high schools. One of the high schools we work with is Centennial High School in Roswell. And, they just had a young man commit suicide, a person commit suicide. I can't remember if it was a young man or a young lady. But there have been several traumatic experiences that have happened with young people that, the pastor doesn't know how to handle. He realized that. We're involved with Fellowship of Christian Athletes. One of the leaders goes to the church. He realized he didn't know how to handle those things. So having to pull... they came to my wife and I, who were clinicians, and then we connected with the summit and looking at building a relationship with them, but finding the resources that we have to help them get the help that they need.
Yeah.
I can't work, I don't have the expertise. I can work with, but don't have the expertise for somebody who comes. We had a person come with schizophrenia.
Yeah.
So then I found another clinician that could help them. And I think we have to begin to build a network of services that whether it's in the church, whether it's in the schools, we can refer out we cannot first educate. So there's the understanding of when something is beyond your level of expertise.
Yeah.
And then have the resources to refer them to.
Yeah, excellent. Very well said. When we come back, we'll continue talking.
Do you want peace in your family relationships instead of conflict? Do you want a safe, loving marriage instead of one that is failing? Are you troubled about what's happening with your children and need help for them? At Legacy Changers Counseling Centers, the goal is to strengthen individuals and families with cutting-edge emotional and mental health interventions. The exceptionally trained counselors at Legacy provide the specialized guidance you need in a safe environment of belonging so that you can make the life changes you and your loved ones need. Get real help for your emotional and relationship needs. Call today at 404-334-7575. That's 404-334-7575. You can also find us on the web at legacychangerscounseling.com. Call now and transform your life today. 404-334-7575 or legacychangerscounseling.com.
We were talking on the break, and it usually happens that as soon as we go off the air, there's a great conversation that keeps going and develops. And so we're going to bring you guys in on that one. Tyson, kind of tell everybody what we were talking about.
Yeah, so we were thinking about the idea that in medicine, which we have given a pass to, it's still the art of practice, right? But we still get this pass. We go to physicians, we go see our doctor, make our appointments all the time. But we don't really kind of carry that over into other worlds of our health. And so we need to have this idea of sort of assigning or outsourcing or being able to realize that, you know, our member of our congregation or our patient needs more support or additional support beyond what I can physically do. And we begin to, as you said before, build that network, then we can start to then trust each other and then trust the capacity of others and not necessarily rely solely on ourselves to provide that service or that resource.
Right. And I think, too, we have to have the conversation from the perspective of the parishioner,
Yes.
right? And so the parishioner who values their spirituality and their faith as part of their holistic health and goes to the pastor for counsel
Right.
because that's just a part of who they are. And there is this disconnect with the idea that if I go to a secular individual, that I'm going to lose that spiritual piece that is so valuable to me, right? And just not that understanding that there is more there, right? And I think that also feeds into, if we're talking about African American churches, that mistrust that's there in general,
Absolutely.
right? The church has always been a bastion of safety where folks go to in times of trouble, and so it's very natural to go to the pastor, to go to the deacon, and have those conversations, right? And if the pastor is not the one, or the deacon is not one to outsource, as you're talking about, therein lies part of the problem. And I think that's probably why I so appreciate the work at Richmont Graduate University,
Yes.
where there is the integration program,
Yes.
right? And so we teach counseling from an integration perspective,
Yes.
from a Christian perspective. And we teach counselors, how do you practice as a clinician, and how do you do that within a faith perspective, especially for folks who need to have
Yes.
that faith perspective
Yes.
integrated into the work that they do in the psychology area, right? And so it becomes incumbent upon parishioners then also
Right.
to educate themselves and to
Yes.
kind of really know
Yes.
that there are resources out there.
Yes.
They may be hard to find,
Right.
but there are resources out there,
Right.
right? And for pastors to know that as well. The other thing that occurs to me is, you were talking about just the idea of families who are caught off guard, let's just say that,
Yes.
when a mental health issue comes up for their teenager, right? Suicide
Yes.
or self-harming
Yes.
or any of those types of things that seemingly for them come out of nowhere, right? You know, and I can't help but think sometimes, you know, when those disconnects come, sometimes, you know, as parents, we pride ourselves in being good parents.
Right.
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 And so there are signs,
Yep.
Yes.
but we either don't want to pay attention to them
Right.
because we internally allow it to speak to our competence,
Yes.
Right.
quote unquote,
Yes.
as parents.
Yes.
And so we just kind of push those to the sides. Or we have had traditionally a great relationship with our children. And so something like that could never happen.
Right.
We have a really good relationship.
Right.
I would know
Right.
if something like that were going on.
Right.
You know, those types of conversations that parents have in their heads, right, become really important for us to kind of be aware of
Right.
and bring to light,
Right.
because mental illness is nobody's immune.
Yes.
Nobody's
Right.
immune.
Exactly.
It doesn't matter.
Exactly.
It doesn't matter. You can have a great relationship with your child. That
Right.
doesn't mean that they can't struggle with depression and
Right.
anxiety.
Right.
They
Exactly.
can still struggle with depression and anxiety. And so even though we talk about family of origin concerns that that can contribute to mental health concerns, on the other side of that is still
Yeah.
great family,
Yes.
you know, very little dysfunction,
Yes.
but still,
Yes.
we have to be aware.
Yes.
We have to be aware and be open and be willing to kind of have those discussions. Yeah.
Absolutely.
And it is really, I'm sorry, it's really just meeting your child or your spouse or whatever, where they are.
Yeah.
Not prescribing or assuming or
Yeah.
just kind of creating this image of them that kind of goes throughout their entire life.
Yeah.
It's meeting them where they are every single day.
That's right.
Because like you said before, you could have a very, air quotes, healthy family dynamic and then something traumatic happens the next day.
Yes.
It could be an accident that they saw outside.
Right.
They could have inspired trauma in their life.
That's right.
And now you have to meet that child where they are right then and
That's
there,
right.
versus assuming, oh, my child is fine, they're healthy, they've always been this way, and they're just going to be just okay. Meeting them where they are will then allow you to have the healthy relationship with them, allow them to have support from you, and then trust you with that information, so that as they are dealing with it and navigating it, every day is an opportunity for them to grow and feel
That's right.
healthier.
That's right.
Yeah.
Well, and I think you touched on a very big thing there in that topic, is that as a parent, you know.
Right.
As a parent, you know
Right.
your kids, you know your
Right.
kids well, and sometimes it doesn't matter if you know them. It doesn't matter if you can
Right.
sense that something. Sometimes you can't sense that something
Right.
is coming,
Right.
but sometimes you can. In the case of that young man that I shared, his mom 3 weeks prior had come to me and said, "I don't know what's going on with him."
Yeah.
She said, "I don't know what's happening. I don't know if it's work, if it's school." He'd basically been kicked off of the baseball team, and she said, "I don't know if it's because he lost playing baseball or anything like that." She said, "But something's going on with him." And she came to me and she broke down and she said, "Look," she said, "I don't want to lose him." She said, "And I don't know what to do. He doesn't want to talk to me about it." And so I said, "Yeah, of course we're going to be praying in that
Right,
moment,
right.
but then also we're going to have that practical application
That's
of
right.
when he comes to me and he breaks down." Like I'm gonna send him to somebody, you know, and I'm glad that his parents took that serious. But yes, you can have those moments where you know, but it's not always that way.
That's
Right.
right.
I think that goes to one of the things you said, Dr. Sutherland, is one, there has to continue to be education on signs of what to look for, change of behavior, change of eating patterns, and not taking it for granted. You know, I have 4 daughters, and one of the things I try to do, with the help of God, consistently is having date nights, or just times where I say to one of my daughters, "Hey, let's go to the store." And we don't directly go to the store. We'll go get something, you know, do some French fries if it's my daughter Grace, or ice cream, you know. But it's something where we're just talking, and I'm just letting them talk about whatever they want to talk about, and in that, seeing where they are. And I think that's so important as parents, because we get so busy in the routine, and like Jeremy says, we said we know our kids, but do we really?
Right.
They're constantly changing.
Yes, they are.
And then having that atmosphere that what I can't do, because they're in a youth group, like with Jeremy, or they're involved in other activities, there's somebody else that has an eye on them that I'm, again, conversing with. Well, how are they doing?
That's
How are
right.
things going?
That's right.
So where you can't predict when something is happening, but you can always be watchful of signs of things that might cause you to need to give extra attention to.
Yeah.
Right.
Absolutely. Absolutely.
Yeah.
I guess the other thing that comes to me when I think about adult men, and even teen men, but adult African American men, is still the difficulty that is experienced just in having the conversations
Yeah.
with other men. Because that's kind of where some of your strength, I would think, and you can tell me if that's wrong, but I would think that some of the strength that men can get will come from other men.
Yes.
Yeah.
Yes.
Right.
Yes.
And having safe spaces with other men
Right.
just to have those conversations. I think of like barbershops.
Yeah.
So you go to the barbershop,
Right.
right? And the only reason I know is because I have short hair.
Right.
So at one point I was going to a barbershop. I haven't been in a while. I'm trying to grow it out. But at one point I was going regularly to a barbershop. And it was men. And it's a whole other conversation. Loved my barber, but you know, wasn't my scene. But men have very frank conversations
Yeah.
in barbershops. Very frank conversations. I never heard one about mental health.
Yeah.
Well, you know, and that's where I've developed programs for fathers for over 30 years.
Yeah.
One of the things I talked about was the barbershop. And that's the barbershop that I grew up in, where it was usually an older barber. You sat in the chair. Now, as a kid, you only sat in the chair if there were no adults there. Other than that, you had to go sit in the corner on the side on the floor.
Right.
But when the guys got in the chair, the barber, how's it going, Frank? Yeah, well, how are things with your wife? I know things have been, and they would actually be doing therapy.
That's not happening now.
I know it's not
That wasn't happening in the barbershop.
Yeah.
But I think that's part of the challenge is that those places, those what we call sacred places, are no longer carrying on. Now, we do need the mental health aspect of them being able to do that, but we find very few places where men can be that vulnerable and a man give them good guidance and say, oh man, all you need is a good piece, or all you need is a good bourbon or something. They need places where they can actually open up and say, hey guys, I'm really struggling with this depression, man, and I'm drinking more. Really to be open of where they are. And I know a lot of churches are looking to try to create that environment in their men's meeting, but that becomes the biggest challenge is, can I trust you to be vulnerable enough to say, this is where I am, this is what I'm struggling with, and you not think any less of me, or you not just degrade me.
But just to kind of go off that idea, and something that you mentioned earlier, Jeremy, is the idea of a king, a warrior, right? Every king warrior, right, philosopher king, had a council that they went to. They would go to that council, they would put everything on the table, all their ideas, all their plans, all their goals, all their conflicts, and that council would meet with them or away from them, or wherever the case may be, to give them resolution, right? So that they have some more strength to go back into the field and continue leading or continue fighting, whatever the case may be. And so we work hard to develop that council, that council idea. If it's at a barbershop, at the church, wherever the case may be, then we feel vulnerable, and we're allowed to be vulnerable in a safe space.
Yeah. Well, and I think it comes in, I think the way we start those conversations is in finding those men.
Right.
And not only finding those men, but being one of those men.
Being one of those men.
Right. And saying, and again, I firmly believe in Scripture, and Scripture says that iron sharpens another man, sharpens another man.
Right.
So as iron sharpens iron, right?
Right.
So if I've got something going on, but I'm a silo unto myself, right? Because I don't have another black man, an older black gentleman to talk to me, right? From his wisdom, from the things that he's learned. If I haven't built that community around myself, that network around myself, then of course I'm going to try to self-medicate. Of course I'm going to try to find other outlets for this. And so I'm going to start the drinking. I'm going to start the partying. I'm going to start the self-medicating with drugs and such. And so now this whole thing is completely exploded when if I would have had 1 to 2, 3, 4 sometimes, right? But 1 to 2 men that I can trust, that I'm going to be open with, they're going to be open with me, kind of this mutual community of man, we're not okay, and that's fine. Let's A, talk about this, and B, let me keep you accountable, right? Let me push you to the point where you say, man, if you're going on with this, let's talk about it. But go see somebody, right? Or go talk to your wife, or go. And so I don't think those conversations are happening, but I think they can start is if we do place ourselves in those community, in that group, in that network.
Yeah. That's great. We have to go to a break, and we've got 1 segment left. So we'll be right back. We'll continue this conversation and wrap it up in our next segment.
Hey
everybody, welcome back to the Dr. Sonja Sutherland Show. We have been talking today about African American men and mental health, and just thinking through all the considerations and just the importance of really being able to have these conversations, men with men, men with their wives, men with their sons, sons with their fathers. And I was just reflecting with our guests, Jeremy, Tyson, and Reuben, that I feel a level of disquiet because I don't want this conversation to end here, right? I know that folks will hear it and it will resonate with people, but there needs to be more than resonance. Right? There needs to be more than resonance. There needs to be a level of ownership and accountability from people who hear this conversation. When you said, Jeremy, it can start with me. I can be that person, right? It's that is just the basis. That is the foundation, really, right? Anybody hearing this conversation, that it starts with you. It's not okay just for the that you know the conversation is happening.
Right.
You have to do something about the fact that you've now heard the conversation.
Right.
And so I think, what I really just want to encourage listeners and those watching on Facebook Live to think about is, now that I know what I know, what am I going to do about it? If I'm a woman and I'm listening, am I going to have this conversation with the special man in my life, with my father, with my son, right? If I'm a man listening, am I going to reach out? Am I going to find those safe spaces to begin to talk about the things that are real to me in my life that could be based in mental health, right? I just really want for this conversation to be more than just a conversation. So, I guess as we wrap up the show, I would love for each of you just to, if folks don't remember everything that we talked about, just what's the most important things? What are two just really critical things that you really want people just to hone in on and remember and take away? So.
Number one, I would say, if you forget everything else, number one is be that man, right?
Yeah.
Be that man that people can talk to. Be that man that people can be open. But also be that man that is going to hold somebody accountable and say, you need to go talk to somebody who has some training, or you need to go talk to your wife about this kind of thing. So be that person and let it start with you, because you may think to yourself, man, I don't really have friends, or man, I don't really have a group of people that I trust that much that I can have those conversations with. Well, be that person and start it, right? Be that person and start it. And with that thought is, go ahead and think in your mind, who are those 1 to 2 people, who are those 2 men that I can trust, that I can talk to? Who are those 2 men? And if you can't think of them immediately, find them. Look for them. Hunt for them. I mean, look for that network, that community of people. Number 2, create that for your kids. Create that for your children before they're teenagers. Create that space in your home with wife, with your significant other, so that mom and dad, let your kids see that, right? Let your kids see your own vulnerability. Let them see that you're working through things, that you have a system, right? Let them see that you have that community, that you have those people that you're talking to, because I think that's going to start. That's how we break that vicious cycle, right? Because it's going to take generations and generations. So this generation, let us start it, right? Let us say, I've got friends that I talk to, and let that be known inside the family. That wife can see it, that kids can see it, and I think it's going to change. I honestly think the future of our families hinges on it.
I agree with you, and I will say this, I so appreciate what you said, because what you said was, if your current circle, if it's not in there, find another circle.
That's right.
Yes.
Find another circle.
Yep.
Growth sometimes demands that we go past the space where we're in.
Yes. Yes.
To people who are doing the things that we want and need to do. So if the folks that you're with are not doing the things that you want and need to do, you don't really need to be with them.
Exactly.
Not in certain realms. I'm not saying go ditch your friends.
Right.
Although occasionally.
You might need to.
But sometimes you need to move past where you are, right? Get uncomfortable and move past where you are. I so appreciate that. Okay.
And it's a little out of order, but I'm going to take the liberty of doing this. I would say I commend Jeremy and who he is and what he does. And the apple doesn't fall far from the tree.
It sure
In
doesn't.
fact, it's directly, because
sure
his
doesn't.
dad is that type
Let's
of
talk
man.
about Teddy Skeete.
His dad, I guess it's for about 7 years we were attending the church, and his dad was just one that stepped in, loved on my family through my going through school and managing, 5 women in a household. His dad was one of those rocks for me. Even to this day can pick up the phone anytime. Pastor T, he's always had an open ear, and he does that, meets with men twice a month. So those are the key people that we need.
That's right.
That are there in the community. And I commend him for the work that he's doing, because he's a reflection of his father on earth and in heaven.
And so you see the generational impact.
Yes.
Right? And
yes.
so when Jeremy says, let it start with you,
yes,
he's saying you can have generational impact
Exactly.
starting now.
Exactly.
Right.
Starting
Exactly.
now. It's not
Exactly.
too late.
Exactly.
Even though we should start with our kids from early.
Right.
If your kids are not that little anymore,
Right,
it's
right.
still not too late to start.
Exactly.
You can have generational impact
Exactly.
starting right now where
Exactly.
you are.
Yes.
Right? And just another shout out to Pastor Teddy.
Yes.
He was the rock for my family too.
See?
Right? I mean, so
Amazing
he
man.
just
Yes,
right?
yes.
And you're following in his footsteps,
Yes.
and that legacy is just going to
Yes.
continue.
Exactly. So the first thing I would say is, as a marriage and family therapist, when I get couples to come in, first of all, African American men don't want to come to counseling, and we're stuck in that stigma of what happens at home stays at home.
Yeah.
And a lot of times they don't understand what they're struggling with. In a lot of cases, are mental health issues, challenges that they're having, whether it's depression, anxiety, various things, enragement, for anger built. So my thing is, go get the help. The men that come in there, I personally focus on helping them where they are. So there are many times where I'll have them come in, even if they can't afford it. Don't take this thing. I'm taking everybody. No, but, because my focus is, how can I help you be who God intended for you to be?
Yeah.
Knowing that all of us are broken, all of us are trying to figure this thing out. But if I can be a part of helping you, but that's something that I learned through the school, through the training, through the development of sharing with someone else. So there are Black African American men out here that are in the profession of counseling. Several others that I've gone to school with, and that I know that mentor me, that are here to help you in this process.
Right.
We have to become the community that we were originated from, in helping each other be the men that we were created to be. So go to counseling, seek out a therapist that can really help you process through, work through, even if it takes medication. Get the help that you need so you can be the man you're intended to be.
Tell everybody once again the name of your practice.
The name of my practice is Lawrence & Lawrence Consultant, 1640 Powers Ferry Road in Marietta.
And the phone number?
The phone number is 404-787-9267.
One more time.
404-787-9267. Reuben Lawrence, I'm on Psychology Today.
Excellent. And in addition, you can also reach us at www.helpformyfamily.com, and we will try to connect you with African American therapists in your area as well. So, Tyson.
Yes, one of the things I just want to say as we get ready to start to close the show is that you're not weak because you need help. You have not lost your strength because you need some support. You're actually stronger because you realize that you need support, and you're actively seeking it out. That's how you get strong.
Right.
Out of all the things that we're talking about here, this is not a sign of weakness,
Right.
that you've lost something. And so in order to be as effective as you want to be, you have to get support. As you said before, you have to sharpen your knife in order to be able to cut it and use it, right? And so seek out that support. If you want to get trained, go to school. If you are a minister listening right now, that's why I love working at Richmont, because it actualizes the unity between counseling and faith. And so go to school, become stronger in your capacity, get stronger in your lane, and seek out strength that way. So that's one of the things I wanted to share.
We have pastors that go through the counseling program.
That's right.
And
Yes.
add
That's
that
right.
on
That's
so
right.
that they can do both.
Exactly.
Absolutely.
Exactly.
You see a need in your congregation,
Yes.
you go get the support
Yes.
to strengthen your congregation.
That's right.
They're coming to you for a reason.
That's right. Excellent.
Right. Yeah. My thing is, I think we all need to realize that no one's perfect.
Right.
You know, and with that said, is you have to make sure that you take care of yourself first, because if you don't take care of yourself, how can you help take care of others?
That's right.
So just piggybacking off of what everybody else has said is just, in the end, in taking care of yourself, you have to realize, in being a man, it takes a man to be able to say that I have a problem,
Yes.
I have a fault, I have a shortcoming, and I need help. And that's the first step in actually getting that help that you need, is recognizing and admitting that you need that help. And realizing that you're not perfect, because we're not perfect. Yes, we are brought up and supposed to be kings and warriors, but as you said before, a king and a warrior has advisors.
Exactly.
So we have to realize that we can't do it all on our own. We can't depend on our own selves in order to prosper and move forward.
Yeah.
We have to go together as a village,
Yes.
not as an individual.
That's right.
That's right.
That's right. That's right. And so I appreciate all of you being here and sharing and really providing encouragement for folks who are listening. And for those who are listening, I thank you for what I anticipate you're going to do in terms of moving forward right where you are. And what you do will model for other people exactly what they need to do as well. So I appreciate you guys.
Thank you.
Thank you.
You'll come back to the show at some point, right?
Yes.
Of course.
All right, everyone. Thank you for listening. See you next time on the Dr. Sonja Sutherland Show.
IBNX Radio.